Ever felt that nagging pain in your gut, the kind that comes with bloating, cramping, or unpredictable bowel movements? Maybe you've tried everything, changing your diet, cutting out certain foods, yet those digestive issues stick around like an unwanted guest. For many, it's easy to assume it's irritable bowel syndrome, IBS. But what if there's something more going on? Something that requires more than just managing symptoms with lifestyle changes? Enter exocrine pancreatic insufficiency, or AP, a condition that can mimic IBS but needs a completely different approach. If you've been struggling with digestive issues and can't seem to find relief, you're not alone. And understanding the differences between AP and IBS could be the key to getting your health back on track. IBS vs. AP, what's going on in your gut? Let's break it down. IBS and AP might feel similar, but they're worlds apart in how they affect your body. IBS is a bit of a mystery. It's a functional disorder, meaning the symptoms arise from how the brain and gut interact. Think of it like a traffic jam in your digestive system. The signals between your gut and brain get mixed up, causing muscles in the bowel to either contract too much or too little, leading to diarrhea, constipation, or both. But even though IBS can cause a lot of discomfort, it doesn't physically damage the gut. AP, on the other hand, is all about enzyme shortages. Your pancreas is responsible for producing enzymes that break down fats, proteins, and carbs in your food. When you have AP, those enzymes aren't doing their job properly. As a result, your body struggles to absorb the nutrients it needs, leading to problems like malnutrition, weight loss, and digestive distress. While IBS is more about miscommunication in the gut-brain axis, AP is a functional failure of your pancreas to provide what your body needs to digest food properly. Symptoms that overlap and confuse. Here's where things get tricky. Both IBS and AP can cause some of the same issues: bloating, cramps, changes in bowel movements. But there are subtle differences to watch for. With IBS, the symptoms can vary based on whether you have IBS-C, constipation, IBS-D, diarrhea, or IBS-M, mixed. You might feel bloated, see mucus in your stool, or experience an urgent need to go to the bathroom, sometimes several times a day. In AP, the signs are often a bit more severe. You might notice greasy, foul-smelling stools that are difficult to flush, a sign your body isn't breaking down fat properly. Weight loss can creep up on you, and in some cases, you might even develop symptoms of malnutrition, like brittle bones or poor night vision. The misdiagnosis dilemma: why AP gets overlooked. Given how much IBS dominates the conversation when it comes to gut issues, it's no wonder that AP often flies under the radar. Doctors are likely to lean toward an IBS diagnosis first because it's much more common. But here's the catch: a 2022 study found that around 5% of people diagnosed with IBS-D actually had AP. So, if your IBS treatment isn't working, it could be a sign that something more, like AP, is at play. How do you know which one you have? So, how do you figure out if it's IBS or AP? Diagnosis starts with understanding the specific patterns in your symptoms. For IBS, doctors look for abdominal pain that improves after a bowel movement, as well as changes in the frequency or appearance of your stool. If these symptoms show up regularly and have been an issue for at least 6 months, it's likely IBS. No visible damage will show up on tests because IBS is more about function than structure. AP, on the other hand, is more of a detective game. Your doctor might start with a physical exam, checking for signs like weight loss, malnutrition, or abdominal swelling. To confirm AP, they may run tests such as stool tests, to check enzyme levels, or blood tests, to look for signs of malnutrition. A pancreatic ultrasound might also reveal fat accumulation in the pancreas, a strong clue that AP is the culprit. Treatments: tailored solutions for two different problems. Now that you know how these two conditions differ, let's talk solutions. The treatments for IBS and AP couldn't be more different. For IBS, the key often lies in managing your lifestyle. Avoiding foods that cause gas like beans, cabbage, or dairy can make a huge difference. Some people find relief by increasing soluble fiber and drinking more water. Stress plays a big role in IBS, so regular exercise, meditation, or simply engaging in hobbies can help keep symptoms at bay. For more severe cases, medications like antidiarrheals, laxatives, or even antidepressants might be prescribed to ease the discomfort. AP, on the other hand, requires something more targeted. The cornerstone of treatment is pancreatic enzyme replacement therapy, PERT. These oral medications provide the enzymes your pancreas can't produce enough of. By taking them with meals or snacks, you can improve digestion and nutrient absorption. Alongside PERT, lifestyle changes like avoiding alcohol, quitting smoking, and eating smaller, more frequent meals can also help reduce symptoms. Living with both, can IBS and AP coexist? It might sound overwhelming, but in some cases, people deal with both IBS and AP at the same time. This makes diagnosis even trickier and means you might need to treat both conditions to feel better. If you have IBS-D and aren't seeing much improvement, asking your doctor about AP could be the next step. Misdiagnosis, a risk to watch out for. Misdiagnosis is a real issue. Because IBS is so much more common, doctors may not always think to test for AP right away. But if your symptoms include significant weight loss, greasy stools, or signs of malnutrition, it's worth pushing for more testing. Early detection can prevent serious complications from AP, like weakened bones or even an increased risk of heart disease. Wrapping it up, taking control of your gut health. At the end of the day, managing your gut health starts with understanding what's really going on. Whether you're dealing with IBS, AP, or both, knowing the difference can be life-changing. IBS might be more common, but AP requires a more specific approach, especially when it comes to proper digestion and nutrient absorption. Don't let gut issues control your life. If your current treatment isn't working, it might be time to look deeper. And remember, you're not alone in this. Whether it's IBS, AP, or a combination of both, there are solutions out there, ones that can get you back to feeling more like yourself again. Stay informed, stay curious, and most importantly, stay proactive about your health. The more you understand your body, the better equipped you'll be to make the choices that keep you healthy, strong, and thriving.